All right, I think we slowly kick off. So welcome everyone. So great to see so many of you to our third instance of ECDC's Modeling Perspective Speaker Series. So as you by now know, this is a series of talks that covers public health modeling related talks. And it's our ambition here to cover not only mathematical modeling, but a lot of the interesting tangential fields as well. And all of this started, of course, during the COVID-19 pandemic with our modeling hubs, and now we're going much wider, and we are working quite a bit with our US colleagues, and so I'm super happy and to announce the speaker of today, who's Jason Asher. Great to see you. He's the director of the Predict Division of the new Center for Forecasting and Outbreak Analytics, the CFA, in the US. Jason has a long history of modeling. He's modeled different diseases, including Ebola, and most recently, of course, he's been involved in the COVID-19 pandemic. Early on, he was involved a lot in standardizing modeling parameters and assumptions, and also himself heavily involved in the actual modeling. Today, we will hear him talk about his Predict team's effort to develop new outbreak analytics tools, and some of them are already openly accessible, which is really exciting. Jason's talk will now be for about 25 minutes, and then we'll have time for questions and discussions. So please feel free to discuss and ask any questions. We do aim to close this meeting 5 minutes to 4 European time. That's 10 minutes to 10 for you, Jason. Thank you for joining this morning. And if you have any questions that you want to ask and you don't want to speak up, put them into the chat. We're looking into the chat. We'll read the questions out for you. So again, very warm welcome, Jason, and take it away. Over to you.
Yeah, thank you so much, Renee. And it's really great to be here with all of you. I do have a good number of slides, which I'll share in a second, but I really think that I want to make sure I reserve some time for questions. So yeah, as Renee said, I'm the director of the Predict Division, which is the modeling and simulation division within the new Center for Forecasting and Outbreak Analytics. And I'm going to talk a little bit about a mix of things, some about CFA's broader strategy. Most of the work that I'm going to talk about today has been focused within the Predict division, but also some other things happening in our Inform and Innovation and Technology divisions. So give me one sec. I tried to present in Teams and it said only meeting organizers can present.
You're now able to present. I found you.
One sec.
There you go.
All right, great. Is that working for everyone?
Still coming up, but yeah, thumbs up.
Okay, great. So the Center for Forecasting and Outbreak Analytics, or CFA, is CDC's newest center. We had a launch event in 2022. So in theory, we're in our second year of operation, but we were formally started right at the beginning of 2023 when we were integrated into the CDC organizational structure. And CFA's mission really is to bring better data and better analytical tools to bear on future public health emergencies. And so our vision is to empower people at every level, the public, state and local decision makers, federal decision makers, to really save lives and protect their communities. And we want to do that by harnessing cutting edge analytics that help improve response. And I think that really illustrates how, while we do have a sort of scientific underpinning, we really are aiming at public health impact. And so in a sense, we have almost more of an engineering focus at times. CFA does its work across 3 main functional areas. Those we use the names Predict, Inform, and Innovate, which align with our division structure. So my division, Predict, is really where we're building our in-house data science team. So it's a group of mostly modelers. And our goal is to deliver actionable analysis to actually support during emergencies, as well as response-ready modeling tools. And I'll talk a little bit more about what I mean there. Predict does its work really closely with 2 other divisions that are still growing within CFA. The first is our Inform division. Inform is really about recognizing, I think, as we all see, we live in a world where modeling results can become front page news. And when that happens, the assumptions of the models, the questions they were intending to answer, their limitations, those are not always adequately contextualized. And that can cause some challenges when it comes to how to interpret modeling, trust in modeling as an enterprise as a whole. And we also think that when you go to communicate modeling results, you really need to take into account the different stakeholders, the different audiences that you're trying to address. And so you might need to create special products. And so Inform is really about centralizing all of that capability that focuses on science communications into one division. And to build that capability that tries to address federal needs primarily initially, expands to state and local needs because the US is a federated health system. And so a lot of the decisions are really made at the local level. I think a number of our colleagues can relate to that. And then eventually also creating information products for the public. Our Innovation and Technology Division, or Innovate function, is really here for two purposes. One is to drive the future state to create new methods and tools to invest in both intramural and extramural research, as well as having a technology wraparound support service. So this will be eventually providing software development, cloud and data engineering, helping with our physical and virtual infrastructure. And then finally, for CFA as a whole, we have this broader advanced goal, and that is that we really try to see ourselves as building a world-class forecasting and outbreak analytics organization. So that's how we try to recruit and retain and train a really technically excellent and creative staff, and try to make sure that we are really building, integrating all of those capabilities I was talking before into this whole organization. So going back to Predict for 1 second, when I talk about response-ready modeling tools, I think there's at least two components of this. One of them is that we actually need to make the tools themselves, and that could be a mixture of things that we either create in-house or some examples, as I'll talk about later, where we're trying to support community-developed tools as well. And we want these all to work together, so we want it to be a kind of ecosystem. We do think there is a role for our own in-house engineered tools that are aimed at trying to help solve our problems, but we think engaging communities as well, the broader modeling community, is going to be key for success. And all of those tools we think will be most useful if they're shared broadly. And we want them to be to a kind of higher degree of software engineering quality than I think is necessarily common. I think many of the people on this call, myself included, have worked in long-term, stressful, challenging public health responses where we have to make tools for the question of the day. And you really can accumulate, as I think we all know, a tremendous amount of technology debt as we do that. And it can take a lot of effort to pay that back. So part of the organizational goal really is to think about how we can be more thoughtful and structured and plan for a future in which we might have to engage with a large-scale public health response for a long period of time. And we want it to be sustainable. We want it to be driven from tools that we can trust, and have a kind of a workforce utilization around those tools that is sustainable too. Another component of that, at least in CDC, is that responses begin and end in programs. So there are pathogen-specific programs that have the ultimate responsibility for addressing those emergencies. And we need to work really closely with those programs so that the kinds of tools that we create are integrated into their day-to-day practice. They need to be things that those programs are comfortable using, that they have experience with, that when we go and co-lead a response with those programs, at least the component of the response that focuses on modeling, that we can work effectively together with those tools. So that's another really key component of how Predict is going to be successful. Great. So one way that you can kind of think about what CFA as a whole is trying to do when we try to give decision makers the tools that they need is kind of across three main domains. One is trying to provide integrated understanding. So this is how do we pull together everything we know about what is happening with an outbreak right now and give this kind of comprehensive situational awareness perspective. This could involve using data directly. It could involve modeling. It could also involve bringing together scientific judgment from a bunch of different fields to really create that integrated understanding. The next set of questions that we see decision makers have commonly is that they want to see the future. They want to understand what is coming in the near future. And then finally, they have a lot of what if questions. They want to know what they can do about what we think is about to happen. And that's where we have this critical role that we can play in helping to inform how people think about the interventions that they put in place. So as an example of one of these integrated kind of understanding products, this past year, CDC, with CFA's work, released the first National Respiratory Season Outlook. The goal here was to provide a really early season. Actually, the earliest version of this product was produced internally in July. And the idea was to think about what could be coming with this past respiratory virus season when it comes to combined burden of COVID, influenza, and RSV. We'd lived through the experience of the so-called triple-demic of the previous year, though that's not my favorite terminology, where we saw that the combined impact of those three pathogens, even as COVID was somewhat receding in terms of its specific impact, really created a lot of burden, especially on pediatric care, but not exclusively. And people were wondering, what could this season look like, again, in terms of that kind of peak burden? And we combined several different things, some subject matter expertise within CFA and within the CDC, some scenario modeling work that had been done by either external academic partners, but also some internal federal government groups, and brought this together to create this integrated product. And what we laid out were some hypothetical scenarios for what we thought was the kind of general range of what peak burden could look like. And in particular, we noted, which maybe to those with a modeling focus is somewhat obvious, that what COVID was likely to do for this past season was lead us to a circumstance where this season and potentially many future respiratory virus seasons as well would have combined burden that's greater than what we would have seen in the pre-pandemic era, though lower than some of the highest peaks that we saw during the height of the COVID pandemic. But that this was the sort of like new baseline that we had to deal with, and that was what we expected for this year. The actual weekly combined hospitalization per 100,000 this year was around 20, so it's more or less in the range of the scenarios that we outlined. This was useful for state and local decision makers who were trying to think about what they might face this year, and had a lot of uncertainty about what peak burden could be in this era as COVID was potentially waning in terms of its specific impact, but where we had seen these resurgence of other respiratory viral threats. That's one example that has some more quantitative components of it, but our informed colleagues are also thinking about qualitative risk assessment. So this is a little less about specifically for Predict, but the idea here is to think about how we can very early in an outbreak pull together the information that we know, what's been happening with disease transmission, historical analogs, existence of medical countermeasures, local public health response capabilities, effectively all of these different dimensions, and try to provide a comprehensive view for people who are thinking about standing up a response or trying to assess the risk that the response could have to escalate further. Thinking about the likelihood of different scenarios occurring, the potential impact of those scenarios, the populations that could be at risk. And so that's a work product that our informed colleagues are really trying to think about, as well as with some international colleagues, in particular at the UK Health Security Agency and Public Health Agency of Canada. But I think we're interested in they are interested in broader collaborations around this. We're trying to think about how we do this really quickly, ideally within days of identifying some potential threat. Many of you know very well that CDC has been engaging in forecasting efforts for a long time. I would say most of the strategy there has been trying to galvanize the academic and research community to work together to produce ensemble forecasts. And these really have represented, I think, a kind of best approach methodologically. We know that multiple models improve the quality of forecasts, and that's been a really key strategy. One of the things that I think CFA is trying to bring to the table here is that we want to grow the in-house forecasting capability at CDC. So we see a future where there are ensemble forecasts in public health emergencies that use CDC models that also invite external collaborators to contribute models as well, potentially even the models themselves, not just the forecasts. And so we took some of the first steps to do that this year. So on this slide is just an example of one of the teams that was submitting influenza forecasts to the CDC Flu Site Forecasting Challenge. And it really was the first time the agency had done this publicly. It was used to produce state-level forecasts of influenza hospitalizations. We did some similar things for COVID-19. And it was really to prove this principle that CDC can pivot quickly to produce forecasts in an emergency. So we're trying to make it so that as early as possible, as early as the appropriate data are available, we have this in-house capability while we work to expand external ensembles. And so we want to have future multi-model ensembles that are generated with in-house technology. This year, we also worked with our immunization and respiratory diseases colleagues to produce this first public RT estimates at the state level for the United States for COVID-19 and influenza. And this was some work that I see Sam Abbott's on the call, really grateful for his help. We've used Epi now too quite a bit. We've also worked with Sam to implement some specific improvements that make it easier for us to do this work. And the goal here, I mean, this was the first time as well that CDC had published this kind of thing. We've kept it going. It's at the state level. It's updated every week. And it's mostly derived from the hospital admissions data that we get through our national, our NHSN reporting system. We're coming to the end of influenza season. As many know, the reporting system that I was talking about there for hospital admissions, the requirement for reporting has ended. And so we are changing this system to focus on emergency department visit data that's reported to us through the National Syndromic Surveillance Program. And starting next week, we'll actually be swapping between the hospital admissions reporting derived estimates to those that use ED visits actually seamlessly. We've been doing some work in parallel to compare and contrast RT estimates from those two sources. And so this similarly is a thing where there is a capability. There were internal RT estimates during COVID-19 that our influenza division colleagues had piloted this kind of work in the past. But we worked with them to create a public website where we could share this kind of work. Again, trying to show that we are getting increasingly ready to have the kinds of basic analytical work like this available in every emergency. I'm really glad to be working with our flu and COVID colleagues on these kinds of challenges. Scenario modeling is a place where we are still building a good deal of capability. And the idea here is to support a really large range of questions. So they are here to ask what if questions like how could some novel variants impact future COVID-19 transmission? If people are considering changes to policy for vaccines or changes in human interest in uptake of vaccines, how could that impact or mitigate future scenarios? What's the role that different kinds of behavioral interventions might play? I know in many of these cases, there's challenges with data. So we're trying to build out our scenario modeling capability. There's a scenarios team right now that's working on some deterministic compartmental models with age structure, some geography, some immune history and vaccination history, so fairly detailed compartmental models. And our goal is to have a more comprehensive capability available for this upcoming fall for decision makers to use. But we have worked on some smaller scenario modeling products to date. So this is a place where we're really trying to build out capability. In my experience through the COVID-19 pandemic, I would say the internal scenario modeling work was some of the most useful things for people wrestling with really challenging policy questions. We're also excited to engage with our colleagues, some of whom I think are on the call here, around the Scenario Modeling Hub in the US. And so I think there's some productive engagements going on there as well. CFA co-led the Respiratory Virus Responses Modeling Task Force this year. So I talked about some of the things that we were doing under that respiratory virus response. But we also provided some rapid analyses around a range of different questions, including vaccination and other immunization averted burden across RSV, COVID-19, and influenza, some peak timing assessments for people at senior levels of government who are thinking about deployment of different kinds of resources that might be limited. We did some early season vaccine uptake projections, so looking at the degree to which we could try to anticipate how many people at the end of the season would be interested in a COVID booster this year compared to previous seasons. We did some work around treatment needs and other kinds of future planning. So on the right, there's an example of some work that we did to consult with RSV drug manufacturers to think about how they can prepare for this and future virus seasons for demand for that particular immunization product. And really the impact of all of this work together was that we really could help people think through a number of different policy interventions. We could do this in relatively short order, so in days to maybe a small number of weeks. And that was some really excellent, I think, additional capability that we were bringing together with the already substantial in-house capability that our immunization and respiratory diseases colleagues had. And so CFA, I think, was providing some excellent early value add there to this challenging response. Another area where we've been doing some interesting, innovative work, actually starting last year, we had an internal group that was thinking about how we could use wastewater data more effectively in various ways. We tried several different things. One of the things that turned out to be the most profitable in some early exploratory work was thinking about how we could integrate COVID-19 wastewater data into our COVID forecasts. And the idea here is that, as many of you may know, hospital admissions data can be substantially delayed. I think it's about 9 days post the last day where we have really solid data before it's really reported in a state that's ready for analysis at CDC. And then that's lagged even further from the time of infection. So we're always looking for new signals that have lower latency and that have more sensor-like qualities. And so in this particular case, we were able to do some retrospective analysis preliminary in certain locations where the data were particularly good that showed that if we used wastewater data at key moments in time, the times that are most challenging to forecast, that wastewater data could improve the quality of our forecasts. And that's just practically because it does give us a little bit of an advanced look about changes and trends that are witnessing. So those most challenging times where disease trends have been declining or they're leveling off and they're about to increase again, and there's no signal of that in any of the other signals, sometimes wastewater does have that. Similarly, it could be that as you're approaching a peak or some other change in incidents that you will witness that in wastewater first. There are a lot of challenges with integrating wastewater data. It can be quite noisy. There are changes in the sampling methodologies and the testing methodologies. So it takes some careful structural analysis to work through all of those different things. It can be outlier detection, some hierarchical modeling. And so there's a lot of work going on there. We have multiple models that try to think about how we do this. And I don't want to delve too much into the science, both because I'm not the best person to speak to that, and because there's going to be more coming on that front. But it was just an exciting example of where we were able to go from a prototype, testing this basically over the year in 2023, and putting it into production this year. So now it is actually available publicly. And this is an area where we're going to continue to innovate. And as I think Sam put in the chat, the code for how we produce these forecasts is available publicly, but I'll come back to that in a second. That wastewater work, we see it as an example of what we've been calling multi-signal fusion modeling, or maybe signal fusion modeling might be a better term for it. Depends which community of terminology you adopt. But the idea here was that the main innovation, the way that we approached the wastewater problem, was to explicitly model wastewater as one more observable that's derived from some latent infection process, just like how we were modeling hospital admissions. And so the idea here is we would like a nice flexible system to bring together multiple epidemiological sources, things that could have different fractions of infections potentially witnessed maybe by age or other demographic group, with different delays, with different observational models and processes, and you want to tie all of that together into a kind of comprehensive understanding of what's happening with infection and be able to produce forecasts for any one of those signals. And that's the approach that we're trying to build upon here. We do this both because we think that it will allow us to get a better picture of what's happening with underlying infection rates in general. Also because it can make it more robust. We have seen that different reporting systems sometimes can change in their quality or their availability. And so we want to have capabilities that are robust to things dropping in or dropping out or changing in how they perform over time. And just to be less reliant on any single data source. And this is another place where we're trying to make some tooling to make this kind of work easier and share that publicly, which I'll get back to in a second. On the collaborative modeling front, this is a little bit more of a technology perspective. So, one of the challenges that we have seen in previous responses is when you're trying to bring a whole bunch of people together to work on an emergency, it's hard to get them the technology that they need. People need scientific workstations. They need workstations with very specific software. The realities of working in a federal information technology environment where you're trying to keep everything secure means it's challenging to get people to change the configuration of their computer and these sorts of things. So what we have done is we've created a cloud-first virtual platform. So it's an environment where everybody who joins Predict, and some CDC and interagency colleagues as well, effectively get a virtual scientific workstation. So it's a computer in the cloud that is pre-configured in theory with all of the tooling that you would need. And it makes it so that in theory, somebody can actually get started in 30 minutes or less. It does not take long to provision any one of these computers. At least that's the goal. That's where we're working on towards. So we've been using this in-house for a good deal of time. It has some integrated file sharing as well. It also has access to broader Microsoft Azure resources so that people have effectively, subject to cost, of course, unlimited cloud computing at their fingertips. We are thinking about how we can deploy this capability more broadly, first with our state and local partners, so some disease modelers in certain states, where they could come into our platform, have immediate access to tools. They could potentially share data if they were interested, or have their own segregated environment where they work on their own data, but to make it so that they actually immediately have access to the same exact kind of computational tooling and technological infrastructure as we have. Longer term, we actually did engineer this to be technically outside of the CDC firewall. It's still secured, but what it does mean is that we did think about international collaboration as well. We're not prepared to support that at the moment, but there is an intention to make it so that we can work with public health agencies around the world, and potentially this is another area where we could collaborate on cloud computing resources, basically to do modeling and software development together. I mentioned a couple of times earlier, and Renee did it in the opening as well, that we are really interested in open source. And so one of the interesting things that we did earlier this year is CFA adopted a public first policy. The US government does have a commitment to open source. The government as a whole is supposed to share a certain proportion of all of the code that's developed with the public. We are trying to be very forward leaning here. And so our new policy is that it is actually by default, if we're going to create a new modeling tool, that as much as is possible, we will first share that code publicly, but not just share it publicly. We will try to do the development of that tool in the public as well. So on the CDC Gov GitHub, that's where you'll be able to find tools that are in development. And so this really is a kind of a change in posture. So this is not like we polish everything internally, and then when we're ready, we share it. We're going to try to actually do the development in the open. We think that's going to pay a number of dividends, both for CFA, because people will look at our tools, will give us critical feedback, may be more inspired to work on things with us as well. But we also see it as part of our commitment to transparency. We're doing work on behalf of the benefit of everyone. And so we want everyone to be able to benefit to take advantage of the effort that we're putting into this. We are starting mostly with sharing the kinds of things that we're building in-house. We're not currently prepared yet to take submissions from people from the outside. We need to build up our technology and innovation staff around that as well. But I'm definitely interested. We are interested in ideas for how we can work more collaboratively on these kinds of efforts. We certainly, as a new organization, are trying to build a lot of capability quickly. And so that puts some tension between delivering products, initial versions of products that we know we have to refine a lot, with trying to develop those kinds of relationships. But we are interested. And so welcome feedback on how we can do that better over time. Just to highlight some of the things that you can find on CDC Gov today, but the list will continue to expand. As I mentioned earlier, the wastewater-informed COVID-19 forecast pipeline that is on CDC Gov. There's a Julia framework called EpiAware that's in development. I'm saying it's for RT estimation, but it's really for considering more flexible RT-like processes for modeling latent infection processes. And then there's a Python framework that's in early development. That's for that multi-signal fusion approach. And that's also that's based on a renewal equation framework that's on CDC Gov as well. There's also some communication products around some of these things. Our Inform colleagues have pulled together a web series. This is intended to be somewhere, not a preprint, not a scientific publication. This is intended to give a little bit of a view into how we're approaching new products. We're trying to share things on this website as quickly as possible, so not going through a longer scientific clearance process, but really to share early work and to explain a little bit about what we're doing. And so there's several examples here, including when we released our RT estimate dashboards, some overviews of what we were putting into play there, when we first released the wastewater-informed COVID forecasting, as well as more recently, some updated isolation guidance. I think many of you know the CDC, the US CDC, we changed the policies, the recommendations rather, around isolation in the aftermath of suspected or known COVID-19 infection that apply to all respiratory pathogens now. And CFA was engaged as part of that process to think about how those changes in guidance could influence transmission. And so we shared some of the earliest results there, actually through this Behind the Model series. It also looked at trying to quantify the residual risk of onward transmission by time post-symptom onset with more recent data that others can talk about a lot more. There will be some scientific publications about this, and a good number of other CDC programs are involved in this work. And so I want to have them around to speak about it too. But I just wanted to highlight that's something that we do, and we're trying to share that kind of qualitative information quickly. With InsightNet, this is our large outbreak analytics and disease modeling network. So this is actually the largest investment to date from the US government in trying to build outbreak analytical capabilities across the US. And so this has more than 100 partners through 12 centers across 24 states in the union and more than 35 public health departments that are directly engaged in this work. And so InsightNet really, the kind of key difference between InsightNet and some of the previous outbreak analytical investments that the government has made is that we are trying to bring researchers that are creating innovative work more directly in contact with state and local partners. So we are trying through 3 different phases of development to get to a place where outbreak analytical tools are broadly available at the state and local level in the US. And that works by having a team of a collection of innovators. So these are people trying to think about new modeling methods, new data sources, and testing them and refining them as research projects. Then a second tier of people that are working directly with an identified state and local partner to test tools that either they know from previous experience work well or things that innovators have developed. To see whether they can actually be useful in the state and local decision-making processes that exist, or B, how they can be refined or adapted to be more useful at that state and local level and prove the principle that the tool is useful in real-time decision-making. And then there's a third tier of researchers that are trying to think about how we can take those innovative approaches that have been tested at the state and local level and then try them in multiple jurisdictions and think about how we can build through that scaling problem. So it's a major investment subject to some more additional funding. It's about $250 million over 5 years. So it really is a substantial investment. We think it's one of the ways that we're going to try to dramatically shift the landscape of the work that's being done here. And I'm excited for that possibility, as well as thinking about how Predict can engage with this InsightNet most effectively, both learning from the innovations and doing technology transfer, but also participating in that research activity and sharing the work that we're doing. We did some initial work a couple of years ago to think about gaps in health equity. One of the things that we noted was that there was a lack of comprehensive data about the co-occurrence of comorbidities in the United States that were relevant for respiratory virus impact, but not just that. So we're working on basically a data collection kind of effort with a research effort to try to identify geographically resolved and subpopulation resolved key health information, so the co-occurrence of various kinds of comorbidities, and pull them together, profiles for specific respiratory pathogens, starting with that, as well as the ability to request similar kinds of demographic studies in the future. And that's a thing that we think will help our modeling work, but also other kinds of scarce resource allocation decisions that have had to happen in the past, and where we've been a little bit data constrained. So what's the kind of future trajectory of CFA? So I think, it starts with us continuing within Predict to develop, test, and implement better outbreak analytic tools and models. We want to share those capabilities so they are more widely available. It's really a theme that I've been talking about today. We're going to try to continue to drive a lot of innovation here and provide direct support to decision makers. And our long-term goal really is to become a trusted go-to source for information during disease outbreaks. And we have a lot of work to do there, but I'm excited about the progress that we've made to date. And so, I'll close with one slide that we use a lot here. And I think I find it helpful as a framing thing. I know that people maybe overuse the comparison between forecasting for weather and forecasting for infectious diseases. But there's something that I like about it, which is that I still think, to use the weather analogy, I think we are in the pre-satellite era of infectious disease forecasting. So I want to live in a future in which forecasting is commonplace. And I'm using forecasting loosely here. I mean, where outbreak analytical tools are integrated into day-to-day decision-making. So you woke up this morning, and I bet a good number of you looked at something on your phone that talked about the weather today, and you intuitively know how to contextualize that information. And from time to time, you use it to make decisions about what you're going to do that day or in the days to come. We want to get to that same place, but where we are with the technology is closer to the left hand of this axis than the right hand of the axis. I think at the moment, forecasting skill is a lot lower than where it can be. And for weather forecasting, it took a lot of things to get closer to the right-hand side of that axis. It did require new data, better data. It required new sensors. Today we deploy satellites, and that's what I mean. We need to think about how we can engineer that entire ecosystem. How are we creating better passive sensors to better understand what's happening with prevalence of disease so that we can then feed that into better outbreak analytical tools. We need to build our computational power. We need to think about the specific decision-making use cases, not just at the individual level in my analogy before, but in the state and federal decision-making level. We need people. We need to train a lot more people. That's another component of InsightNet, but that's something that I think we all need to work together to build a lot more workforce. The state and local level does not have the people it would need to really integrate like every into their day-to-day decision making, and so we need that. We need better tools, and we need sustained funding. These things took a long time for weather forecasting. They are expensive. But we now know that weather forecasting saves lives. It is cost effective in the long term. And so that's the future that I'm excited to be working with all of you to build. And so with that, I'll be happy to stop and take questions. And I saw a good number of questions came in the chat. But,
yeah, thank you so much. Yeah, let's maybe give it a few seconds for people to digest. Jason, this was a wonderful talk. A lot of inspiring projects and ambitions. You at the CFA have a lot of resources, and you are using it very well, and also very beautiful slides to look at. Thanks so much. We can maybe start with one question in the chat a bit high up. That was regarding your in-house models, and the question, you mentioned that you want to have an ensemble models, but this question is from Esther also, if you also include a multi-model ensemble from externals, so from universities and researchers. Could you speak to this?
Yeah, so I mean, I think to use the weather analogy, I think that we want to use our academic partners in the same way that the National Weather Service uses NCAR, the National Center for Atmospheric Research. So we want to think about that as the place where people are incubating new technologies, new techniques, new tools to produce forecasting, and then we definitely want to leverage that. So it could be using a contributed model from an academic researcher. It could be a slightly re-engineered version of that same kind of approach, but implemented in a different framework that we're ready to run in-house. And that's more about computational efficiency or something related to that. So there is part of this technology transfer and engineering problem. But we also want to create a world in which people can contribute externally generated forecasts. Some challenges around this involve there may be multiple internal data sources that we want to forecast, that there isn't a really feasible path to share those externally. So we have to think through some of the technological solutions, like how people might be able to contribute containerized models that come packaged with workflows that can actually be implemented in an internal system, maybe by different deployers. So I think there's a lot of components to that, but we want to find multiple ways to leverage people's work. And every time we can share data publicly, we are interested in how other people can contribute forecasts as well. And we just need to balance the data access challenges, the timeline challenges where we might need work right away, like within days or weeks. And we can't quite wait to to form a whole consortium to produce a forecast. Like sometimes so we need to have a way to address that full range, that full spectrum of capability.
Yeah. A lot of balancing for sure. Thank you, Esther, for the question as well. We've got a question from Kat, who's got her hand raised. So please go ahead, Kat.
Hi, Jason. It's lovely to see how much you guys have done since you started. It's really impressive. As you know, I'm on the coordination team of the Scenario Modeling Hub, and you and I talked, about how useful in-house models are for scenario design during Omicron. You and I had those chats on the side, for example. But I want to talk from a sort of more personal point of view about my research group and how I could contribute to something like this, because I never applied in my own right to InsightNet, because my group does some modeling, but it isn't necessarily a modeling group. What we do is we develop improvements to methods. So just to remind you, the mods process demonstrated the Scenario Hub framework because forecasts don't need to have regular meetings, but the scenarios are different every time. So you have to have the group meetings for clarification. That was then adopted by this group here in the EU. We also have worked very hard on improving scenario design. And then my group has done work on the aggregation methods. So there's been a shift in aggregation methods. Emily Howerton, my student, also led the evaluation of Scenario Hub so that we know it's reliable for scenarios as well as forecasts. And we've just done work, for example, on how many models do you need? Do you need as many models if it's this type of question versus that type of question? So these sorts of contributions, I think, are valuable because they change the process. And I see Sebastian's raised his hand too. He and I have just, for example, joined the advisory group for the collaboratory at the Pandemic Hub, at the Pandemic and Epidemic Intelligence Hub at the WHO Hub in Berlin. But I'm really interested in how my group can contribute to CFA, but in terms of streamlining processes, making it work faster, making it work with fewer resources in emergency settings. Do you always need multi-model scenario projections, or can you get away with fewer models? What would be, so very much a personal, my group question, what would be the way that we could contribute, given that we're not an insight net, and that the sort of rapid funding has dried up since the pandemic has been sort of deemed to be done? What ways could someone like me contribute to the US efforts?
Well, thanks for your question, Kat. I mean, I think that InsightNet is very large. It doesn't cover everybody, and it doesn't cover all the things that we think are really useful. So that's a fact. I think that the real focus there is to try to drive the capabilities at the state and local level. That was our primary focus, and we wanted to connect a research agenda to that. As a secondary benefit, we think that will also help improve the technologies and capabilities that we built in-house. So I don't think I have a very succinct answer to your question, to be honest. But I think many of the things you're talking about are certainly relevant for how we think about how we spend our time and our resources. And we welcome that kind of research. I think it's a little different than some of the primary focuses that the change that we were trying to make with InsightNet. But I'm happy to talk with you further, maybe offline, about how that connects to some of the things we're doing internally. As you can see, as you noted, a lot has happened in a short period of time. We are kind of like a startup in government. We're trying to be the best parts of a startup. And what that means is, like, week to week, we have more capability than we had in the past, and our requirements shift. And so I think that's really exciting. It's really dynamic, but it's also hard to connect that then to a research agenda where things might take multiple years to be useful. And we're trying to think about how, balance all of those things. So I'd love to talk to you about that more. I think many of the things you talk about, we think about, and certainly are aware of a good amount of that work. I think we haven't gotten to the stage where we're trying to down select and think about, okay, do we really need all of these specific tools or these others? We're trying to build some of the first alpha versions of this and sketch out our own capabilities landscape there. But I definitely appreciate the spirit of the question, and interested in talking to you more.
Great. Looking forward to that collaboration. Seb, please go ahead as next.
Yeah, hi, Jason. Thanks. That was great and fascinating, all the stuff you're doing. On the weather versus infectious disease forecasting, my understanding of the increase in weather forecast scale is that it's a combination of better and more timely and higher resolution data, and some improvements in model and computational capacity as well. Where do you see the improvements coming from in infectious disease or forecasting, and where do you see, like, the CFA's role in driving that?
Yeah, I mean, I definitely think that the future that I want to live in and that I was talking about there will require new data sources. I do think to some extent that is coming. CFA isn't the data-focused part of the house, but it's a critical enabling capability for us. And so I think that passive sensors are going to be really key. I don't think we know exactly what those look like yet. I think wastewater is kind of in the right direction. I think air sampling potentially as well. I think personally owned devices, like your future smartphone or wearables. I think in-home devices as well. There are already companies that have, desktop PCR samplers that are cloud enabled, and they can link all of these things together. But that's still not a true passive sample because you're still relying on human behavior. I think that for obvious reasons, clinical data is extremely important for understanding disease burden. But I think that if we want a future, we need these kinds of we need things that have well-defined sensor performance, and then figure out how to translate that into public health relevant measures. And I think it's that synthesis that's really going to change how well we can do this. I mean, we have challenges all the time where we produce forecasts and say, okay, well, that forecast didn't seem to be as well calibrated as I hope. And then you dig a little bit into the places where it performed the worst, and you think, well, goodness, that's actually a data problem, not a forecast model problem. And what does that even mean? And it makes you question a little bit the goal there, right? So I think you have to co-evolve these. I used the term forecasting, though, a little bit more broadly and non-technically when I was talking before. What I just meant was any kind of forward-looking statement. And I think that there is still a lot of role to be made, a lot of gain to be made by improving our modeling capability there, even in the absence of substantially improved data. And I say that because every decision maker I've worked with has a mental model. They are employing models all the time. When they examine data, they synthesize it, and they come up with some action plan on the basis of that. And what I would say is that at times our brains are incredible processing machines, but we don't always make the best decisions when we're left to our own devices to integrate it. And so what I'm trying to do is think about how we can be explicit about the assumptions that we're making, and think about how we translate limited data, even potentially poor quality data, into better syntheses and better understanding that's derived from that data from the modeling tools. And I really do put that a little bit in the broader forecasting umbrella in the spirit of the name of our center. But even though it's not technically a quantitative forecast about what will happen in the future, it is one of these activities, either creating an integrated understanding using modeling tools, or trying to think about how interventions might play a role. And so I think that if we take that broader view, I think on the modeling tool side, there's a lot we can do today to help make decision making better, while also working on this kind of precision forecast. How do we challenge internal modeling assumptions? How do we make sure we have sensors in the environment that collect data that would let us know whether our models are even representing the laws of the physical laws of transmission, if you will, and the softer socio-behavioral laws of transmission too.
Thanks a lot. We are out of time, so I would suggest we have one more question from Kath, and a very quick answer. And if you have time, Jason, maybe you could respond to Till in the chat, who has got two related questions. So you can do that after the talk. But Kath, if you want to go next.
Thanks. So I had two questions, but I will stick to one. So the main question that I wanted to ask is from an infrastructural perspective. I'm really interested in this idea that you're creating a resource for standing capacity. So outside of emergency response, the aim of the CFA is to, create this kind of solid, standing, very highly technical resource. And I wondered how you translate that into practice, because I think that's probably quite difficult to do just in really practical terms of like contract and as an employer. So I was wondering if you could speak to that at all.
Yeah, thanks, Pat, for your question. So when CFA is fully staffed, we'll be about 135 people. My division is just about 50 of those. So we intend to, and those are federal employees, so those are full-time employees. So part of it is about creating a pretty large modeling team within the federal government. We're also trying to think about surge support. So there's a couple of pieces of that. One of those is InsightNet. So a component of that is to also have people that are kind of pre-positioned and ready to work at the state and local level, and where we have provisions in that cooperative agreement to be able to give additional resources in the event of an emergency, to have them work directly with those partners and with us. And then additionally, we are putting in place some things internally to be able to surge staff in an emergency. And so that would be to bring additional data scientists, engineers of all different kinds, and modelers in to work with us. I could envision something like, a hypothetical future COVID emergency. We might have 200 people working within Predict, and they would be sort of focal. They would be agglomerating around the focal units that we have in our existing teams, but they would expand large in size. I mean, it's complicated for sure. I think my goal really is to make it. I lived through the COVID pandemic modeling work in the U.S. The number of months where we worked 13 hours a day was innumerable. That's not sustainable, right? I think many of you guys on the call have had the same experience. So we are trying to figure out, well, what does it look like to have to address a large scale emergency, but have it look like part of routine operations? Like people can take a break and you can take 2 weeks off, and you're not the only person who can make an analysis happen. And that requires thinking through this like an emergency support structure. And so we did design Predict a little bit around a combination of different activities, teams that are focused on regular production of products. Like this is the team that's going to make weekly forecasts. And when people have questions about the forecast, they're going to go to someone else. That team's going to be laser focused on continuing to deliver. And then we have other teams that think about analytic response. So when someone comes with a question, they're supposed to pivot, use their subject matter area expertise and try to address the decision maker question quickly. So there's a lot that goes into it. And then we need to exercise it. That's the other part. I think we can't wait for a large scale emergency to see whether or not this works. We have to test it in routine, smaller scale emergencies, do synthetic exercises. So yeah, I've spent a lot of time thinking about how we can make this more routine. There is another component, which is we're competing for talent. And that is really challenging. It's a limited talent pool. A lot of the kinds of skills that we need to make CFA most successful, a lot of technology companies are interested in hiring those kinds of people as well. It's challenging getting people to work in the federal government sometimes. I think we've been really successful to date. I think that people are who work on this kind of thing are excited about the kind of thing that we're trying to build and see it as an opportunity to get engaged. And so we're trying to build on that, but we definitely have to do a lot of work to train the people that we bring through the door to keep them interested, to make it a place where they could spend 5, 10, 15, an entire years or an entire career and see a really full scale progression from maybe an earlier training program to being part of the leadership eventually too. And so there's a lot that goes into that succession planning and training too, but I'd be happy to talk about it more.
Thanks. Thanks a lot, Jason, and thanks, Kath, for the great question. Yeah, we have to round off. This is fantastic. Thanks again, Jason, for a great talk showcasing parts of what the CFA has been doing in the last 2 years. So really, really happy to see and very much looking forward to more and to see what's coming out there. Thank you, everyone, for being here, and have a great rest of your morning, Jason, and rest of your afternoon, everyone in Europe. Bye all. Thank you.